Assalamualaikum warahmatullahi wabarakatuh, and hi everyone. Okay, for today's topic, we will gonna discuss about nutrition in emergency. Before we start, let's watch the video first.
They're killing everyone.
It's a massacre.
The United Nations are here now.
We're here as peacekeepers, not as peacemakers.
We've got trouble at the gate.
This is a 4-star hotel, not a refugee camp. I have no means to protect these people.
When a country descended into madness
They're killing Tutsi children to wipe out the next generation.
and the world turned its back,
How can they not intervene? Hundreds of thousands are dying.
If people see this, they'll say, oh my God, that's horrible. And then go on eating their dinners.
one man had to make a choice.
All the whites are leaving, even the UN soldiers.
All the superpowers, everything you believe in, Paul, they're not gonna stop the slaughter.
Around the world, the case and the number of the emergency continue to rise, and the children are the most affected. What cause of the nutrition emergency? This is because of the conflict, drought, earthquakes, famine, and due to the flood. This happened because of the natural disaster. The most affected category due to the emergency will be a mother, children, and the sick person. So, how to deliver the nutritional support services for them? The most foremost priority is to prevent death from the starvation and diseases, and we want to reduce the malnutrition. To do this, we should support the mother to safely and adequately feed their babies during the emergency. For the children who are suffering from the malnutrition, we can provide therapeutic feeding to save life and deliver the essential micronutrient to prevent and treat the deficiency. Furthermore, close coordination with water and sanitation and healthcare program help to safeguard the children's nutritional status. We also can work with the communities to address the underlying problem that create these situations and to build the resilience in the household, communities, and system to withstand crisis and cumulative stress. The next question is asking about what is the best practice that we can do during the emergency. There are 7 key points that we can do during the emergency. The first one is by providing the life-saving treatment. We can supply the ready-to-use therapeutic foods, and we can work with our partner to manage this issue. The second one is by delivering the key micronutrients to the vulnerable groups. We have to ensure that the mothers and the children have access to the supplementations and fortified food so that we can address the micronutrient deficiency. The third is by providing the young and children child feeding support program. The fourth is by conducting assessment and surveillance. Fifth, by strengthening the program. Sixth, by developing the standard and norms. Last but not least is by fostering the resilience, where we can work with the community to plan for restraint and to bounce back from the crisis. So we, as a nutritionist, what can we do to improve our practice and help the preparation for the complexity and the reality of working in an emergency context? To manage this complex emergency, as a nutritionist, we must have a skill in to be a good leadership during the crisis. We should be prepared with the potential demand in order to guide our staff during the emergency so effectively. We also can maximize the staff resilience. This is because there are some staff members are often exposed to the suffering, and they may be personally exposed to the dangerous or demanding work conditions on the regular basis. We can also manage the psychological first aid by providing the basic care. We, as the nutritionists, should have this ability to supply effective psychosocial support, and this may be among our most important abilities and responsibility that can greatly contribute with the long-term well-being. We can also find another way to assist our staff post-crisis. This presents the additional action that can be used to assist our staff members or our friends during or after the complex emergency, including psychoeducation, correcting self-recognition, rumor control, assessment, and referral. To sum up, protecting the nutritional status of the vulnerable group who are faced with the emergency is essential to prevent them from the acute malnutrition, disease, and death. I hope you guys could understand for today's topic. So, till we meet again. Bye.